Stroke remains a top killer in this country and a top cause of permanent disability. The outcome is closely tied to the speed in getting medical treatment. Here's what you need to know in this week's Positively Healthy. Time is brain. It's a phrase often used in relation to stroke. About 85% of strokes are ischemic, caused by a clot that blocks blood flow to an area of the brain. Starved of oxygen, brain cells begin to die.
The central area will actually die very quickly, within minutes. It's like drowning. There's no oxygen to that tissue.
Dr. Hunter Brown is board certified in emergency medicine, practicing at Physicians Regional Medical Center, which is recognized as a primary stroke center. He points to rapid imaging technology and treatments that allow doctors to minimize stroke damage during the first critical hours.
Our goal when a patient presents with stroke-like symptoms is to rapidly identify those symptoms and get the patients over to radiology for a CAT scan. That CAT scan is read within 30 minutes. An NIH stroke scale is performed.
Clot-busting drugs may be used to dissolve the clot and restore blood flow. If performed within a brief window of time, it may save delicate brain tissue around the central core.
The surrounding tissue, which is fed by small vessels, forms a penumbra, compromised tissue that may actually be reversible. You may be able to save that penumbra.
Getting this life-saving, brain-saving treatment is predicated on getting to the hospital quickly.
When patients are concerned about stroke, think fast. Is there any facial asymmetry? Is there any arm weakness? Is there any difficulty with speech? If so, it's time to call 911.
Given the importance of time, knowing the symptoms and keeping your personal risk factors in mind may provide you peace of mind.
Patients absolutely need to maintain a low threshold for seeking medical care if they feel they're having a stroke, especially if they have risk factors. If they're diabetics, patients with hypertension, and high cholesterol, or a family history of stroke, any symptoms whatsoever.